The work that I prepared to present is do NGS-based techniques represent a first-line testing in suspect Duchenne muscular dystrophy? At first, let's let us know about Duchenne muscular dystrophy. Duchenne muscular dystrophy is a genetic disorder characterized by progressive muscle degeneration and weakness due to alternation of a protein called dystrophin that help keep muscle cells intact. The dystrophin is a skeletal and cardiac muscle. Dystrophin is part of a group of proteins that work together to strengthen muscle fibers and protect them from injury as muscle contract and relax. Where is Duchenne muscular dystrophy gene? The gene for dystrophin sits on the X chromosome. If we have a normal gene for dystrophin, the protein of dystrophin is present that we have normal. If the gene is missing or altered or have a mutation, dystrophin may not be produced, and the result is Duchenne muscular dystrophy. Duchenne muscular dystrophy inheritance. Mother carries the recessive gene and pass into her child. People with a family history of muscle dystrophy are at higher risk of developing the disease or passing in on the children. As you see in the picture, the pattern of is recessive from carrier mother to her child. Symptoms of Duchenne muscular dystrophy is difficulty rising from a lying or sitting, trouble running and jumping, waddling gait, walking, large calf muscles, muscle pain and stiffness, learning disabilities, and delay growth. And about our case that we work and study about it. Our case history. Our case is an 8-year-old child with muscle weakness in his arm and legs, and carried these symptoms from childhood. Walking difficulties and chest deformity are two of the most common clinical issues seen. Electromyogram was performed, and the electrical findings are consistent with a chronic myopathy patterns in proximal muscles. Our subject has a positive family history. His maternal uncle died on a muscular dystrophy, and his cousin also suffered from the disease. Okay, you can see in these slides, uh, the picture A is our case that we studied about. As you see in this picture, this child has a deformity of chest and problems in walking, and the pictures of B is the pedigree of our case. The pedigree of the study family. In the family tree, you can see that our case have an family history, and two of their family suffered from this disease and died. But about the NGS, next generation sequencing techniques, for detecting of this case, we use a new technique that called NGS, next generation sequence. Uh, we want to know about more about NGS. Next generation sequencing is a massively parallel sequencing technology that offers high throughput and speed. The technology is used to determine the order of nucleotides in entire genome or targeted region of DNA or RNA. NGS has revolutionized the biological science, allowing labs to perform a wide variety of application and study biological system at a level never before possible. Our result that sequence this case genome sequencing performed and the data were analyzed. No strict pathogenic point mutation was found by exome sequencing, but our data showed micro duplication in exon 10 to 42 of the dystrophin gene. The dystrophin gene has 79 exons that make him the big and the large gene. Our data show micro duplication in exon 10 to 42. But why we use this technique for this case? Why this is important? As you know, mutation. We have a variety of mutation in this in Duchenne muscular dystrophy. Uh, we have large deletion, we have a large duplication, we have point mutation, we have a small mutation. All of all of this mutation, we can detect it with one technique. The traditional methods that we do it for diagnose of Duchenne muscular dystrophy, uh, they can only detect large mutation, but a small mutation that cause Duchenne muscular dystrophy is are still unknown. The whole dystrophin gene must be sequenced to detect a small mutation, uh, but this work is time consuming and costly. But the NGS technique has recently emerged as a method for detecting a small mutation and duplication in order to identify all region of the Duchenne muscular dystrophy gene. Okay, as I said, a small mutation, rather the large deletion and duplication seen in Duchenne muscular dystrophy, should be considered accurate molecular detecting. Molecular Duchenne muscular dystrophy diagnosis is critical for identifying women who have a carrier in their family, which is important because it allows affected individuals to be identified in future pregnancy. With this work, we propose that the NGS technique may be used as an efficient and cost-effective molecular diagnostic strategy to identify microduplication mutation or all of small mutation in patients with Duchenne muscular dystrophy, which are difficult and expensive with traditional methods. Thank you for your attention. Do you have any question? Can you hear me? Do you have any question?
Thank you, doctor. Thank you so much for your presentation. Does anyone have questions?
Thank you for your kindness and have a good time. And I hope we have a good conference. Thank you for everyone.